Hello everyone, I'm Dr. Barry Swindler. I'm a chiropractic physician and a certified applied kinesiologist in Wake Forest, North Carolina. You can find me at www.chiropractorwakeforest.com. I'm here today to talk to you about whiplash and the proper treatment of whiplash injuries. Whiplash, you've heard that name probably used, and is where actually the head is thrown back and then it's thrown forward. Usually with car accident, rear end collisions, it can happen with a person that has a slip and fall on the ice or thrown from a horse or any type of injury where the neck is thrown back and then thrown forward. We call this hyperextension and hyperflexion. Other terms are acceleration, deceleration syndrome, but we'll just use the term whiplash. You can see that in a whiplash injury, the bones, the ligaments, the tendons are injured in this process. It needs to have corrective care to restore the function of these structures, and if not, the spine can go through degeneration. People do experience symptoms with whiplash injuries, and there could be a big variety of symptoms, but some of the common ones, of course, is neck pain, neck swelling, some tenderness at the back of the neck. You could have a headache, muscle spasm, and very oftentimes you can have pain that radiates into the shoulder and down the arm. The soft tissues that are injured in a whiplash injury are the disc, the ligaments, the muscles, the facets, and even the TMJ, the temporal mandibular joint, is affected. People can often have cranial faults, and when I talk about cranial faults, I'm talking about the cranial bones in the skull. Since the muscles attached to the skull, they can affect the cranial sutures that are involved. Also, people can have contusions and bruises in the spine. Corrective care for whiplash injuries is imperative, so there isn't any degeneration that takes place in the spine. Very often times that I see people in my office for non-related car accidents or any whiplash, they're having pain in their neck, and I go to ask them about their history, and they tell me, well, 5-10 years ago I had a car accident where I had whiplash. Well, this condition was left untreated, and now they have lost the curve in their neck and their spine is starting to degenerate. We are made to have certain curves in our spine, and in our neck we're supposed to have a curve somewhat like the contour of my hand, and that same type of curve in our low back, and the opposite curve in our mid back. This is a representation of the spine, although it is straight, but it goes to show you the structures of the spine. And in the areas that I'm talking about are the disc at each level, and the disc is a soft tissue structure in between each vertebra. And it's there to be as a shock absorber, but also to allow movement at each vertebral level. Now, in a car accident, when the head is thrown back and then thrown forward, what happens is it damages the ligaments that attach between the bones or the vertebra of the spine. It affects the facet joints, and these are the facet joints here between each vertebra. These allow for movement of the spine. Along with the ligaments, we have tendons. Now, tendons attach muscle to bone. Ligaments hold bone to bone together. With the tendons, they are damaged, and of course the tendons are associated with the muscles of the neck. The muscles of the neck are the main treatment area that I focus on with correcting the function of the spine. The body neurologically turns off these muscles when the head is thrown back, because the body wants to protect itself by keeping the head back to where it was. But the force of the impact from the rear end collision is going to neurologically turn these muscles off. So it's the doctor's job to get in and do the manual hands-on therapy of these muscles to get them turned back on so we can restore function back in the neck. And I'm going to have a patient of mine come over, and I'm going to demonstrate a muscle test that I do in my office to evaluate the strength of the neck flexors. So if I can have my patient come over, have a seat on the table, I'm going to show you a very common muscle test that I do in my office. When I find these weak muscles, I then ask the body a question, what's going to turn them on? And that is involved in with getting into the belly of the muscle where the spindle cells are, and also where the muscle attaches. So here's Jeff's here, and I'm going to demonstrate very common muscle tests in my office for treatment of whiplash injuries or any condition a person has in the neck. So I'm going to ask Jeff to bring his chin down to his chest. I'm going to place my hand on his forehead and ask him to push his hand into my head. And I meet his resistance, and I push back, and I find that his neck flexors are weak. I can also test the sternocleidomastoid muscle, and that muscle attaches behind the ear, and it runs down here and attaches to his chest here at the sternum. So Jeff, bring your head all the way down, turn your head all the way to the left. My hand's going to go on the side of his head, and push your head into my hand. I'll meet his resistance, and I'm going to push back the other way, and we find his weakness here of that muscle. The proper therapy is to figure out what's going to turn these muscles back on. Again, the muscles are the main structures responsible for the curve in the neck. And with those muscles being weak, it's only going to allow the neck, the spine, to straighten. What I mean by the spine is the neck, we usually have a curve something like this in the neck. Weak neck flexors are going to allow the neck to straighten, and therefore the disc to degenerate, and also the bone to start making changes that are also common with degeneration. Many people seek different types of care for whiplash, whether it be going to the hospital or their regular doctor, and that is fine. If you need to take pain medication, please do. I advise people to seek the care of someone that is certified in applied kinesiology. That is a technique I've been certified in for about 10 years now. Applied kinesiology, or AK is what it's commonly referred to, is a muscle testing diagnostic tool that I use in my office, and it is the main tool that helps me restore the function in the spine. We are dealing with muscles that are injured here, and with muscles in the belly of the muscle, like for instance the sternocleidomastoid, there are spindle cells that are affected, and there are also Golgi tendon organs that are affected, and we need to figure out what's going to strengthen them, and by strengthening them is going to allow the proper function in the neck. So that is why someone would choose seeking a chiropractor that is certified in applied kinesiology, that uses the tools that help correct the muscle dysfunction, that is going to help restore the function of the spine, to one, help the patient return to good health, and also prevent any further degeneration. You can contact me at 919-349-9413. You can also find me on the web at chiropractorwakeforest.com. Thank you.